This morning, Dr. Hopkins makes his usual rounds to check on his surgery patients from the day before.
You mind walking? I have so little time for exercise that I've made myself a promise. I'm never going to use the elevators again in this hospital. So I haven't used the elevators for a long time. And it's not a lot of exercise, but it's better than nothing. Mrs. Schamberger, how's she doing? Okay?
Just got
here. Yeah, okay, good. You feel okay? Good? A little headache? A little sore up in here? And that's just from the incision, and that'll go away soon. Hello, Mr. Miller.
Hello.
How are you doing this morning?
Very good.
Good, good, good. Good to see you. You still want to go home tonight?
Yep.
Okay. If
Now
you
they're
do,
trying to get rid of me now.
okay. If you do well through the day today, we'll be able to let you go home for dinner tonight.
Okay.
Okay? Well, you just saw the difference between Mrs. Schamberger and patients who have undergone endovascular procedures. The open surgery requires a much longer recovery time, and it's much more uncomfortable for the patient. It's basically an incision in the head that has to heal, and it means her hair got shaved a little bit, and so it's going to take her longer to recover than it would somebody who just had a catheter-based procedure. Here's Judy Pastor's films. And Judy had an aneurysm that arises right here on the artery just as it enters the cranial cavity.
Basically, I had good general health, except for a few migraine headaches at work. I thought I had sinus problems. One day, I experienced something strange when I was having dinner in the kitchen. I was going to the refrigerator, and just as I was ready to turn back to come to my chair, I became dizzy and the room started spinning around. So I told my husband that I was not going to be able to make it back to my chair on my own, so he came and helped me into my chair. And the vertigo continued for about 3 minutes. The second time I had vertigo, I was also in the kitchen. And I made it to the chair and I sat down by myself. I sat there for about 3 minutes and it went away. The third time I had a very bad case and I was down and out in bed for about 3 days, where the room kept spinning around and I was getting sick to my stomach often. After that, I decided I should contact my primary physician, who then sent me to a neurologist, and then was introduced to Dr. Hopkins as a neurosurgeon.
Vertigo and headaches. That was a tip-off that she had something wrong inside, and her doctor had performed a scan which demonstrated a large aneurysm.
When I met Dr. Hopkins and he looked at the MRI, my husband was with me, and he said my options were surgery or surgery.
Two problems with her aneurysm. One is that it was located right adjacent to the base of the skull. Part of it was inside the bony base of the skull, and the other part was just peeking out into the brain area. And two, the other problem was that this aneurysm didn't have a little narrow neck like this that would hold coils. It had a wide neck like this. So we knew that we couldn't coil this aneurysm and successfully completely occlude it. We also knew that for surgery we would have had to do a major procedure where we'd have to, like the dentist, we'd have to drill away all the bone at the base of her skull in order to expose the entire aneurysm. That would be a high-risk procedure.
When Dr. Hopkins told me I had to have surgery, I was shocked, and he said that eventually, if I didn't have this done, that I would have a stroke. He said I have a choice of going the old route or trying this new procedure. So I went home with my husband and we talked it over, and we decided that I would try this new procedure that he was talking about.
We first navigated a little tiny stent or a sleeve up across that wide-necked aneurysm. And that stent then gave us a scaffold through which we could push our microcatheter and then fill the aneurysm with coils.
I feel great now. I still have sinus problems now, but I've not had any bouts with vertigo or dizziness or anything since this surgery.
Coming up, could you be at risk of a stroke? This test could save your life.